Major move today in California's fight against coronavirus. As we've been telling you since it was breaking news, the state now says anyone 65 and older can get the COVID vaccine. But so far, at least one county is pumping the brakes on this. Now, we know you have a lot of questions about the vaccine, where and when you can get it, and potential safety concerns.
And so with the help of Patrick Healy, Nurse Alice Benjamin, we're going to dedicate this segment to bringing you some answers and hopefully a little bit of clarity. Patrick, we're going to start with you. Obviously, you have been covering this pandemic for us and the vaccine extensively. Where does Southern California stand right now on getting these shots to everyone?
Well, clearly, Chuck and Colleen, there is a big push right now to speed up the rate of the vaccinations. We are 4 weeks into this process now, and quite frankly, there is a lot of disappointment on several levels that more vaccine is not getting into more arms. There's the initial problem, not as much delivery from the federal government as it was promising, and secondarily, once the vaccine gets to the states and the counties, it's not going out as quickly as was originally hoped. So there are steps underway to try to improve the speed on both levels.
What about the large pharmacies, Patrick? Walgreens, CVS, you know, they've been giving out vaccines for the flu shot. Is this where most people are going to get the vaccine, or are they just going to help in the distribution of it?
Well, very likely they are going to be a key element. The major pharmacies, I should say, particularly Walgreens and CVS, already are deeply involved, the main providers to long-term care facilities, which, as you'll recall, that's right at the top of the priority, getting the vaccine to the residents and staff in those long-term care facilities. That, for the most part, is being done by Walgreens and CVS. But now the next phase will be for them actually in their stores to have their pharmacy techs begin vaccinating those who are looking for the COVID vaccine. Now, we're told that that will begin in New York tomorrow. Not as soon in California, but ultimately the state says there are 69,000 pharmacy techs. They've been authorized to give vaccinations, but they don't yet have the green light to start.
Patrick, two quick questions here. Who's got the answer to all of this? Is there somebody you can call and find out, yeah, you can sign up and here's the number? And realistically, what is the timeline for all of this?
Well, for your first question, Chuck, the governor heard your question, and today he promised that the state would have an online application available starting next week, the governor said, where you can go, you can see if you're eligible, and you can even register so that when you do become eligible, you will receive a notification. The governor said a second phase of that online system, that software, will enable scheduling for vaccinations. But that's part of the problem right now, is that the rules are different in different counties. Orange County, for example, at Disneyland, Vicki Vargas was showing us today, many seniors going to get their vaccinations because seniors have now been green-lighted by the governor, and this was done at the urging of the federal government. But today, Los Angeles County says it's not there yet. It is still dealing with the high-priority healthcare workers, needs to make some more progress before it can begin doing the senior vaccinations.
As always, Patrick Healy never lets us down. He's got an answer for every question. Colleen.
You know, Chuck, as you well know, some healthcare workers are refusing to take the COVID vaccine even after being given priority access. Roughly 20 to 40%, that's a pretty good number, of LA County's frontline workers who are offered the vaccine refuse to get it. Now, that's according to public health officials. Joining us in this segment right now, once again, clinical nurse and NBC4 contributor Alice Benjamin, to help provide some context to all of this. Let's start with that refusal of the vaccine. Are there still concerns over the safety, the fact that some people think this may have been rushed to the public here?
I believe so, and I think that's with healthcare professionals as well as the general public. And as healthcare professionals, we want to make sure that we have all of the information, understand the statistics, have really done the research to understand the data so we can better explain it. And I think part of some of that refusal is also, Colleen, you have to understand, we're so focused on trying to take care of other people. Oftentimes healthcare professionals put others before themselves. So I believe also that might be contributing to some of this, just making sure that we can get out there and take care of people.
So what are some of the questions I should ask my doctor before I sign up for this vaccine, with that in mind?
Well, I think it's really important that everyone, have the opportunity to talk to your healthcare professional. Do an inventory of your medical conditions. Discuss allergies that you may have. If you are someone, especially if you have allergies to any food or medications or any injectables, how severe are those allergies? And if you're allergic to any injectables or vaccines, ask your provider, is this a vaccine that I should get now? Should I wait? And then also part of that conversation, if it's determined that the risks of getting sick from COVID-19 are greater than maybe a minor allergy, you'll want to identify, if possible, a location that for sure is going to be prepared to make sure that they can handle any type of severe anaphylactic reactions. We have lots of places popping up that'll be giving vaccines. It's going to be important that the viewers are informed consumers, making sure that wherever you go, if you're that person, that you're staying for the full 30 minutes to be observed, that you're going to a location that does have an anaphylaxis severe reaction kit, and health professionals there that can get you to a hospital immediately if needed.
Good advice there. I was just thinking about that. Now, here's some other questions. You're going to have to wear a mask after you get the vaccine?
Absolutely. I think masks are going to be here. I'm going to project for at least another year. And again, that's just my projection now. It might be even longer than that because it's going to take some time to get everyone vaccinated. I mean, we're still working on healthcare professionals here in Los Angeles. Then we're going to be working on 65 and up. And then we're going to get to the otherwise younger and healthy people. And we still have, our young folks, people who don't even have a vaccine available to them yet. So it's going to be quite some time that we're going to be wearing masks.
Can you get COVID from the vaccine, or can you test positive after you get both your shots?
So the COVID vaccine is not a live virus, and so you cannot get COVID-19 from the vaccine itself. The vaccine is intended to help your body identify the virus, develop antibodies so that you cannot fall ill if you come in contact with the virus itself. But it's going to be, important that people understand that the COVID vaccine is a two-step process. It's going to be important that you complete both vaccines for full coverage. And then also, until you get that full two-part vaccine, be very mindful of your behaviors because it is very possible that you may come in contact with the virus either prior to your vaccine or between your first and second vaccine. So you may very well still contract COVID-19. So you have to be very careful.
All right, Nurse Alice, as always, great information. Thank you for your insight. It's our understanding, too, when you sign up for the initial shot, you actually sign up for the booster shot as well. So thank you again. Yes. Lots of great information, but still, so many questions about the vaccine, about COVID. We've tried to streamline it for you on NBCLA.com and our NBCLA app. There's also an interactive tool detailing your county's vaccine plan when you are eligible to get your vaccine.